Hello, how you doing today, you guys? This is Dr. Keith, the vegan naturopath, coming at you again with another quick wellness news nugget. This nugget is from Reuters Health. It's entitled Anti-Depressants in Pregnancy Tied to Health Risk for Kids. So in other words, if you are a female that's pregnant, or you know someone who is a female that's pregnant, they may want to understand that if they're taking antidepressants during pregnancy, then this could cause problems for their children, not only early in their lives, but for years afterwards. The article says that children exposed to a common type of antidepressant in the womb may be at an increased risk of complications soon after birth, and not only soon after birth, but years later, according to two studies. One of these studies suggests that newborns are more likely to need intensive care after birth if their mothers take selective serotonin reuptake inhibitors, or SSRIs, during pregnancy. A second study finds those same children may be at an increased risk for speech and language disorders years later, which is an indication that the effects of these drugs stay in the system for years to come. The article went on to say that links between SSRIs and these types of birth outcomes have been seen before in previous studies, but these studies weren't as reliable as this new study says. They quote Dr. Eva Pressman, the chair she's the chair of gynecology at the University of Rochester Medical Center in New York. She goes on to point out that women should make decisions about their SSRI use or these antidepressants only after talking with their healthcare providers about their specific circumstances. The article went on to point out that Ulrika Norberg of Lund University in Sweden and colleagues analyzed data on about 750,000 births in Sweden from 2006 through 2012, and about 2% of the children had been exposed to these antidepressants, these SSRIs, while they were in the womb. And about 14% of these newborns exposed to SSRIs were admitted to the neonatal intensive care unit. So these drugs actually, after they were born, put them in intensive care after birth, compared to about 8% of those not exposed to the drug. So that's about 6% difference in those who have been exposed to the drug who ended up in intensive care and those who had not been. And not only that, in the second study, the researchers analyzed data on more than 56,000 children, most under the age of 9, to see if those who had been exposed to these drugs in the womb were most likely to have cognitive problems. These children were born between 1996 and 2010 in Finland, and about 28% had been exposed to SSRIs during pregnancy. And another 17% were born to mothers who had depression but did not purchase SSRIs during pregnancy. The remaining 55% were born to mothers who didn't take SSRIs and did not have depression. And basically it says that there were no links between SSRI exposure in the womb and scholastic or motor disorders in the children, according to Dr. Alan Brown at Columbia University in New York City and his colleagues, who included researchers from the University of Turku in Finland. But as reported in the Journal of American Medical Association Psychiatry on October the 12th, for children whose mothers purchased at least 2 SSRI prescriptions during pregnancy, the risk of speech and language disorders was 37% higher than it was for children whose mothers had depression but didn't take the drugs, and 63% higher than for children whose mothers didn't have depression. So basically, the overall thrust of this article is that if you are a mother, or if you know someone who is, and they are thinking about taking these antidepressant drugs, all drugs have side effects. Just understand that, both known and unknown. And so if you are thinking about taking these antidepressant drugs, understand that the outcome could be very detrimental to your baby, not only once they're born, but for years afterwards. This is Dr. Keith, the vegan naturopath. Till next time, take care, and remember to subscribe and like or comment below.